It's now time for What's Up Asheville, sponsored by the city of Asheville, with the host, Mr. Sam Parada, and here he is.
Hey everyone, welcome to What's Up Asheville here on WRES 100.7 FM. I'm your host, Sam Parada, and today's episode is about the REST team, which we'll get into in just a moment. But first, we're joined by Adam Hurdt, engineer. How are you, Adam?
Good, how are you?
Doing great. Also, Patrick Crudup, assistant chief for Asheville Fire. How are you?
Yeah, thank you, Sam. Good, how are you?
Anytime. And TJ Fortenberry, lieutenant. How are you today?
Good, how are you, Sam?
Doing great. Thanks for asking. So it's been a while since we've been trying to do a show about REST, and finally we got you guys settled in. But before we jump into that, I just wanted to ask, I feel like the fire station is always so separated from the rest of the city work and stuff. You guys are in a different building. So how is it working for the city's fire department? Anyone can jump in at any time.
Are you asking how the fire department is or how the REST team?
Fire specifically, day-to-day stuff.
As far as the fire department goes, same business we've been in. So I've been here going on 26 years now, and we're still out there for the community every day, just out there to help with whatever needs we have.
26 years of working on the truck and putting fires out, or how's that evolved?
So 24 on the truck, then transitioning over in 2023 to the REST team, which we consider ourselves, we're still firefighters. We still do some of the same duties we did a couple years ago. We've just advanced a little bit in that and just took a little role and was able to fill a hole in the community that wasn't being filled before.
Yeah, so REST, what does it stand for specifically? It stands for Resource Engagement Support Team, and that's where we fill in the gaps of the community. An example would be, used to we'd have a subject down, and they might just be sleeping, need some help, and the fire department would pull up and, they would look and get with the subject and be like, well, he's just, he's resting. Nothing we can really do. So that's where we step in now and see, hey, how can we help this person, right,
get off the street? What could you do to help him so he's not having to sleep on the sidewalk? So that's kind of where we step in.
Okay, so you're more of a people-oriented, kind of service to provide assistance when it's not emergency related necessarily.
Absolutely, and we can step in, and what one of us or two of us can do, we can put a fire truck back in service, or maybe a police unit, and they can be ready for another emergency, while we're assisting with this problem that's going on.
So you mentioned that it's been 2 years, but so how did REST come to be? Do you have some background, Chief?
Yeah. So the REST team came to be when we first started out. The team, we were called Community Responders. That was our initial name for the team. The county had a team that was Community Paramedics, and we decided to change our name so we didn't get confused with the two. So people would call for city services or county services.
Yeah.
We didn't want people to be confused at who they were going to be getting. So we want to make a clear distinction just in the name alone. So we landed on REST, which is Resource Engagement Support Team. And that's where we are now. When the team came along, what was happening in our city is we were getting responses from business owners, citizens about challenges we were having with unsheltered populations within our city limits, also the cleanliness of our city as well. So we were asked to develop a team to reimagine public safety, because as Lieutenant Fortenberry mentioned before, we could respond to a subject down, and we would get there and they might be sleeping, but there was nothing that fire truck could do for someone who was just sleeping or needed to be woke up. because they had to return to service to answer the next response. With the res team, what happens is the team can respond to that call for service along with an apparatus, and sometimes even arrive on scene before the apparatus, and solve an issue and provide wraparound services for that person, and then check back in on that person to give them the best possible care. So that is Asheville Fire Department reimagining public safety. The team also will put an apparatus back in service so they can be prepared for the next call, as well as an APD unit. So they solve many problems and many challenges in our community.
Especially like things that you couldn't really do before. In the past, as you mentioned, was show up, nothing we can do, leave. And now there's the option to stay and provide that assistance. So you mentioned partnership with APD. What kind of other partnerships do you have as the rest team?
Yeah, I'll let Lieutenant Fortenberry address those.
So that's been one of the challenges for the last couple of years. So Asheville is a place that's full of many resources, and so we've had to learn in the last couple of years to pretty much team up, and find these resources. So we work with APD. We also work with sanitation. We might come up on an encampment that's been abandoned and there's, lots of trash left around. So we get with sanitation, set up dates, make sure everybody's out, work with APD, make sure everybody's out. So we collaborate in that way to make sure cleanliness, everything's taken care of. So
Safety. Safety first.
I always hate to say that we just APD. It's everybody in the city that pitches in, all the departments. So
yeah, I mean, if you want to give them shout outs right now, it's a great time to do it. Sanitation's one.
Yeah, sanitation's one. I'd hate to miss it because it is everybody. Like everybody pitches in, and just doing this job, we've met a lot of people and then found out what they can help us with and what we can help them with. Then the community's getting to know us a lot better, and they reach out to us a lot. A lot of the business owners will reach out. They might have an issue, so we help them that way.
So you mentioned that you have it's you guys. There's the county paramedics. There's the difference between the two, and I assume you have like an ambulance that doesn't work with the city. So like at what point do your responsibilities begin, and when do you hand that off if that's the case that you would have to do that, like send someone away to a hospital or I don't know.
So that's what we do every day is like a triage. So and I've always said this, everybody says, what do you do every day? And I said, I really don't know what I'm going to do today. Like you try to get a plan, that it changes. But I can give you an example. Like we're in Code Purple right now.
Yeah.
So that's pretty much our main focus. And what we're trying to do is get everybody into shelter by a certain time. Well, there's some individuals that might miss the cutoff, So we're giving rides, calling around, just try to make sure everybody can get where they need to be before,
Totally.
They don't have a place to stay at night. But sometimes people miss them, like 9 o'clock. We usually run from about 7 to 9 and later, like Code Purple, we'll probably be running later right now. But if we leave and somebody's still in need, that's when APD, they're 24 hours and they'll pick, and they might have to pick up that.
Okay, so so rest is more of a during day hours kind of work.
Seven days a week, 365 days a year.
Well, yeah.
But but we don't run 24 hours like the fire trucks do. We do. What's good about the rest team is I have 300 firefighters behind me that can assist me every day. If I have a problem, I can still call a fire truck, APD, stuff like that.
Everyone.
But we're 12 and a half hour days, 13-hour days.
So both of you used to be on a fire truck for a while together. Yes, I made sure that they both would be sitting here at the same time. So How different is the change, the responsibility now that you're working with REST, Adam?
It's a lot different. We go from 24-hour shifts to day shift. You know, we're home every night. We do work a few extra days, but the transition from a fire truck to this, your responsibilities change. You're not responding to emergency calls anymore. You're able to see a call through to the end. So if you've got someone that needs your help, and you're actually able to do as much as you can. Where you know, on a fire truck, a lot of times you'll be
limited to the emergency type.
Sure.
Do you miss those crazy hours with the fire truck? You don't have to answer that.
I miss the action.
Yeah, you miss the action. Yeah.
But we still get to do it some. So.
Oh, so you every so often get to jump on the truck and help with a fire emergency?
Yes, sir.
Oh, okay. So they have you on the quick dial.
Yeah, we're the multi-tool.
And how do you manage? Do you manage both teams, or how do you manage your staff with these kind of responsibilities?
Yeah. So I am the operations chief. So those individuals that they mentioned serve on the operations side or the response side, emergency response for our city.
Yeah.
The REST team, I would say, is also a response team as well. With both of them falling in operations, they work well and complement one another together. It took a little while for the entire team to realize that the REST team was there and what they were there for. But once they realized that the REST team was there to complement them, they're calling the REST team now often to assist. So as far as managing both those teams now, they've blended together. It's pretty seamless now.
That's good.
The work that needs to be done.
That's good. Yeah, I found that if my position was suddenly shifted to work on a different role, but complementing my current one, it would take some time to get adjusted to that, I imagine. But I mean, 2 years now, and how do you feel the REST team is doing at this point?
I mean, I guess we'd have to ask the community and the department. I've got a survey. We have to put stuff in, and we go back and look, and how much we've helped. We've thousands of people we've helped. Hundreds of trucks we've put back into service, so they can do so. Definitely the change and the help to the community is there. So I would say we make a big impact. I hate to speak for myself because,
Well, I mean, this is time to do it.
But, I mean, if you look at everything, it was definitely something that was needed in the community.
Yeah.
And going back on it, they just wanted us to do this for 60 days to try to clean up a little problem. And it just went so well. They were like, can y'all stay? Can you hang around a little bit longer? And then it went through the process, and city council approved us to be, a permanent fixture in the city.
Yeah, and when the team started, Sam, the team was mainly focused on the central business district initially.
Yeah.
And as time passed, the responsibility of the team grew.
Yeah.
So it expanded into other areas of the city. So the team kind of went back to the drawing board and said, hey, we need to start hitting these areas too. And they kind of start branching out into other areas of the city. And the team's done quite well, to be honest. I do receive a lot of positive feedback from the team and their responsiveness. Oftentimes, if I receive a phone call, I can reach out to the team, to Lieutenant Fortenberry, and within minutes, within less than an hour, the problem has been resolved. So very responsive team, very adaptable, a very adaptable team.
Yeah, I mean, I feel to be in this position, you kind of have to be. So, yeah, I feel like it comes with a job, but it takes a very unique style of person to just go out in the community, talk to people, help them find the best way to, assist, because nothing can be solved by just, all in the same way. So that actually brings me to a question for both of you, which would be if you have a specific story of that time you went out and helped someone, and when did it click for you that this is what you're doing now?
So I think one of the first ones that comes to mind, we had a Marine Corps veteran that was stranded here from Minnesota, and we were able to reconnect him to his family and assist him in getting back home.
Mm-hmm.
You know, being able to do that when there's not anybody else, you know, for that person to turn to. Actually, Chief Crudup met him and gave us a call, and we were able to connect. And
So it was a connection through you that you found this gentleman, and then the rest team approached?
Yes, so he was actually on the side of the road holding a sign that said Marine veteran, need help. So I actually spoke to him and found out what his need was.
Yeah.
And once he kind of explained what his need was, I reached out to the rest team, and we were actually in South Asheville at that point, off of Long Shoals Road. So that tells you how far the team can expand and go outside of downtown.
Right.
So the team traveled out to South Asheville, met up with that individual, and was able to provide resources to get that individual back home.
Well, that's great. And then, so are the cases similar when you go out, or do you have like a big range of different situations?
everything's different.
Everything's different.
Yeah. It could be somebody needing medicine from a pharmacy, somebody needing to go to the doctor for something that's not a medical emergency. Could be.
But they just don't have the resources to do it.
Exactly.
Yeah. And so if someone had called 911 in, let's say, 2022, and said, hey, this person needs this help, or I need help, the answer would have been, sorry, we can't help you with this. This is not something we do. Here are some other resources, but that's basically what it used to be.
Yeah, what you probably would have got is that call would have came in through 911, maybe a passerby would have called into 911. You would have to dispatch, and you got a fire truck with 4 people. They would have responded quickly, as normal. They would have got there. They would have did a PCR patient care report to kind of figure out, hey, what the needs were to make sure that the person was not in any physical harm. And once they would have determined they didn't have any physical harm, pretty much their job would have been done. Yeah. And they would have tried to say, hey, maybe we can call APD or, call someone.
Yeah.
But they have no way or resource to drive them to a location or connect them like the team does now.
And now they call rest.
Oftentimes, because the team is proactive, they can listen to the radio and they can hear those calls coming in, and they're proactively moving in that direction, looking to connect resources, sometimes before the fire truck even arrives, but definitely while the truck is en route. So often if the truck beats them there, their request or already hear that CR1, 2, or CR3 is already en route.
Right. So like, hey, call the rest, and it's like, we're already here. So how would a member of the public go at actually calling and getting in touch with someone from the rest team? Is that it is not 911, I would imagine, or it is?
It kind of is. So we have an Asheville app, but if it looks like it's an emergency and something needs, it's still 911, and it's
totally, yeah. If it's an emergency, call 911. I'm not saying.
Well, even that Asheville has the non-emergency line. It's 828-252-1110. If you think it's not that big, you can call in that way as well. But dispatch is trained to say, hey, this is probably for the rest team, fire department, and that's how they separate it. So we don't necessarily take calls right over the telephone. We don't have our own hotline. Or
it's not
like
a direct line to rest. Unless you want to give them your phone number.
I've got 2 emails here that are, I don't want to say low priority, but less, that we can get to, and we just kind of dispatch them out and take
Yeah.
them. I mean, we stay pretty.
So I'm just saying, so people have an idea. I thought that maybe you guys prefer if you're contacted through a non-emergency means, but yeah, call 911 if you have an emergency, and if you need to get in touch with either fire or the rest team, I think that would be an appropriate action to take.
Yeah. So to add to Lieutenant Fortenberry, we have the ASHRA app
Mm-hmm.
that he mentioned. Also, 211 is a resource as well.
Can we talk a little bit more about that?
Yeah. So 211 is another resource. And while we're talking about the REST team, we talk about our firefighters that make up the REST team, but we also have peer support specialists on the team as well. So Miss Hillary Jones, she manages that side of the REST team. So we have her. She manages 2 peer support specialists who have lived experiences.
I see. I was going to ask what are the differences.
Yeah, so those specialists have lived experience, and they're able to go out and make connections as well with our unsheltered population.
I see. And I assume the REST team is involved with the COC. We've talked about that in the show before, the continuum of care. So you have all those connections within that organization too.
That's correct. And Hillary is very versed in the COC.
Okay.
So she kind of works that side for the team.
Yeah. Great. And going back to 211, I used to work for 211 back in college in Tallahassee. So, I did the night shifts, I did the call center stuff. But when we went through Helene, and I believe even the water crisis of 21, I think, there was mention of 211. And I think they do different stuff. So if you're knowledge about it, can you tell us what 211 regionally here in Nashville does and what it offers?
Yeah, so 211 here, if you call, you get connected to a professional who is able to direct you to the resources that are available here in Asheville. So if you're the one who's experiencing homelessness, you can call 211 and find out where resources are on your own. Of course, the team could call 211, but the team now is well connected to most of the resources in the area.
Right.
They have a plethora of resources and contacts that they've made, which is what has made them so successful as a team in our city. They've actually become a model, and sometimes we receive requests from other cities on how we've done with our team. Hillary actually went out to San Francisco out west.
Wow.
To talk about our team and how we established and how we work within our city. So our team here in Asheville has become very well known throughout the country and other areas in the United States.
And how did that take shape internally? I mean, you're building something from the ground up, 2023, and how did that process evolve, or even for you guys, like, you're the ones doing the stuff. So did that change as you guys were working on it, or just talk me through that?
So, yeah, our job changed daily. So we were asked to try to help solve a problem, when we come in, and we had no clue how we were going to solve it. Well, yeah, we had no clue how we were going to solve it. So we just took and our skill working at the fire department, helping people, and said, well, we could do this or try this. And we've been thrown a lot of just crazy calls. I remember a certain call, if I got time. One of our people got sent and saw a lady, and she was crying on the sidewalk, and he tried to speak with her, but she was deaf. And long story short, he was able to communicate with her through writing. And she had been robbed, and she had ran away from an abusive relationship out of Mississippi.
Yeah.
And the whole team worked together on this because everybody doesn't work 7 days a week, obviously 12 days a week, so it kept getting passed off. But by the end of it, we were able to get this lady shelter, money, food, and we were able to get her back into a house that was safe and get her off. Now she wasn't unhoused when we met her. She just ran across some really bad luck really quick. So,
and that's all it takes.
Yeah,
really.
And we run across problems like that a lot. But I remember we had to work out, and I think I got up at 3 o'clock when they still had the bus station down on Swananoa River Road.
Mm-hmm.
I had to get up at like 3 in the morning and make sure we got her to the bus station and stuff like that. So.
Wow.
And I think we're probably one of the only resources around that takes it all the way to the end. We don't quit. Like, that's one of our things. We stick to it until we get that problem solved. So that's one thing that we all saw. Adam, would you agree? Like, if we could stick to it to the end, and we'll figure it out. We don't give up. Like, I'm not saying we don't necessarily get the outcome we want all the time, but we definitely get to the finish line with everything. So.
Yeah, that definitely gives you a lot of pride and ownership with what we do, and it allows us to feel like we finished the job.
Yeah, I mean, I had Sydney Muncha from, she's with the neighborhood service, the homeless services, and she works with the COC. And she did say that the top 3, and this surprised me, one of the top 3 ways to help homelessness was by just being kind and treating people with respect. And it sounds like that's your approach, really just talk to them and see what the need is and just go from there instead of being judgmental or, throwing blame around. I don't know. It's easy to be in a position of fortune and not see people as people when they're not in that situation. So yeah, thank you for the work that you do. That is a really good story, and I hope that her and everyone else you've been helping sees a good outcome. Because the more people we help in our city, the better the city is overall. So yeah. Do you miss, though, the action of being a firefighter like 24/7, or would you go back to it now that you've been working with REST?
So the good thing about us is we keep up our certifications, and sometimes we get short. The fire trucks get short, and we can put in for overtime and work on that fire truck, so we can get our fix, on the fire truck.
Right.
So.
Yeah. There are times where, on the operations side, where we may have to up staff because of inclement weather or certain events that may happen in our city.
Yeah.
So we up staff above our normal staffing levels. And often, or at times when that happens, whenever a member of the REST team is not currently working in the role of REST, they will come and work on the operations side of the house and ride those trucks because both Lieutenant Fortenberry and Engineer Hurdt are at the top of their positions when it comes to experience and reliability on the operations side too. That's where they were before they left and went to REST, and that's what makes them very unique, that they're able to do that. And we have 2 others as well that work on the REST team in the field that can also do the same thing.
Well, sounds like you got good people.
Indeed.
I mean, I saw it in action during Helene,
Yeah. And even during Helene, the REST team, they did some incredible work.
Yeah.
Through the state level, Department of Human Health Resources, they wanted to make sure that there were individuals who were accounted for.
Yeah.
And if you could think during Helene, that's a huge task to be able to go out and figure out, are all these people on this list accounted for or not? Well, the RISK team took on that responsibility and completed that task.
Well,
so job well done, even during our worst time.
Job well done. Well, thank you so much for coming here today. Again, if you need REST assistance or the REST team assistance, call 911 first. If it's an emergency, call 911 first. If you think that you need to get in touch with REST, and feel free to help other people. Hopefully you guys are an inspiration to the community as to what we can do and how we can help each other. And yeah, we'll see you after the holidays, and have a great day, everyone.
Thank you.
Thank you.
You've been listening to What's Up Asheville, sponsored by the City of Asheville in collaboration with WRS 100.7 FM. This program will re-air every Monday, Wednesday, and Friday at 12:30. Thank you for listening.